Breaking news on the coronavirus. Just moments ago, China's National Health Commission confirmed 830 cases of that virus and now 25 deaths.
All right, so how worried should we be? How does it compare to other diseases, and what's being done to prevent it? Clinical nurse specialist Alice Benjamin is here to answer your questions, and we got those new numbers here, and we want to know that when we hear the term coronavirus, should we automatically freak out, or what should we know?
No. So what's important for people to know is that coronaviruses are a group of viruses. There's actually 7 coronaviruses. Some of them just present as common cold symptoms, nothing too major, and some have severe symptoms. So what we're talking about today is the most recent of the coronaviruses, referred to as the 2019 novel coronavirus.
What are the symptoms that people have when they have this particular strain that everyone's so concerned about?
Right. So the symptoms can be very vague. So cough, fever, shortness of breath, some GI upset, some diarrhea. So those are very common. That could be a fever, or excuse me, it could be the flu, a common cold, anything. But what's most important is if you're presenting with those symptoms, looking to identify if you've been in close proximity to someone who has been to China or an area where that virus is alive and well.
Okay, so who's most at risk here?
Well, so we're still trying to figure that out. I mean, what we do know is that people who are vulnerable to chronic illnesses, who have weakened immune systems, are people who are more susceptible to any type of illness. But we're still trying to learn a lot about this virus. What we do know is that it seems to spread respiratory-wise in air droplets. So if you're around someone who's coughing, sneezing, breathing, you see those droplets fly when someone gets excited and they talk. So those are the things that we're concerned about, especially in someone who's been infected. If the droplets are exposed to you, then you might get exposed. You might develop the virus.
We've seen a lot of people at the airports. We've seen shots from LAX with people wearing the mask. So does that help? Does it protect you against the droplets? Is that a good idea to perhaps wear that?
Yes, absolutely. Good hand washing, wearing the mask. If you feel that you've been exposed or afraid of exposure, you'll want to separate yourself from anyone who you think might be sick. So, and that's what they've been doing. They've been keeping people who they believe are exposed to the virus away from the general population. And that's important because we don't want to cross-contaminate or spread this. There is human-to-human transmission with this. Although this was, in China, we suspect that it was related to animals, we have seen human-to-human transmission as people at the market were affected and their family and friends have been affected.
All right, the biggest takeaway before we let you go here.
It's going to be important that if you're going to do any traveling internationally, that you make sure that you protect yourself. Hand washing, wearing masks, staying away from people who have cough and cold, making sure that you're current with your immunizations, and really, if possible, avoid areas where this virus is present.
You mentioned that they're canceling Chinese New Year celebrations in China right now, really trying to stop the spread of this.
Yes, that's absolutely important. We have over 7 million people who convene to celebrate Chinese New Year. And so it takes one infected person to infect the masses. So I think that's a wise decision, and they should be doing that.
All right, Nurse Alice, appreciate it as always. Good seeing you.
Nice seeing you.
All right.
Thank you. And new research shows that children who get the flu vaccine are much less likely to be hospitalized for flu-related complications. The